Well, thank you. Again, as Barbara mentioned, my name is Nicole Herdman. I'm a customer success consultant with Trust Health, and we're excited to be on the line today to walk through the e-intervention platform and to provide some exciting solutions that the Oklahoma Department of Mental Health and Substance Abuse Services have partnered with Trust Health, as well as the Omno Group. So here's our agenda. Again, we'll give you a little bit of background on our partnership with the state of Oklahoma. We will walk through the actual e-intervention platform, so our referral management system and patient engagement components. And then in particular for the hospitals on the line for the OPIC collaborative, as we talk through rolling out the e-intervention platform, we'll give you more specifics on what that scope looks like and how we would ask you to participate in specific next steps after this webinar today. And then we'll leave it open for some questions and answers. So again, just some background on our initiative with the state of Oklahoma. So we have been working with Oklahoma Department of Mental Health and Substance Abuse Services, like I mentioned. So we are partnering with them to really drive these solutions for both providers and patients around substance use disorder and behavioral health technology, and providing the specific resources and treatments to the residents of Oklahoma. So as part of that partnership, the OPIC collaborative also has been given some great attention and really driving in the focused work around pregnant women and their babies. So this is an overview of our current provider network through e-intervention and Trust Health. So you can see we have set up several different substance use and behavioral health organizations that are live using our e-intervention referral management system. And then on the right-hand side, the additional organizations we are working to implement as well. So the thought would be around your hospitals and your hospital organizations identifying these specific treatment providers to send referrals to for substance use or behavioral health services. So again, I want to just pause here and really drive in, the mission and purpose behind both, the Omno and OPIC collaborative. And why Trust Health, has partnered with the state of Oklahoma to really focus in on specific technology solutions that can help drive motivation for patients to seek treatment, and really also follow through on that potential referral and request for services. So, we can see here just the statistics and sheer, concern that Oklahoma has been working to improve upon. So we're just excited to be a partner in this work as well. All right, so we'll go ahead and jump into the actual e-intervention platform. We'll give you an overview of what the system looks like, each of the key features and functions. But firstly, I know there are plenty of clinicians and providers on the line, so really wanted to call out, we intentionally built, and with feedback from clinicians, the e-intervention platform to be as quick and seamless as possible. It is a very intuitive, user-friendly platform, which you'll see throughout the presentation, really just knowing that your time is limited, but we want to provide and provide the best quality level of service and offerings to our patients and families. All right, so we'll walk through kind of the typical referral management or referral process that we have worked with many other customers with. So firstly, the specific referral management aspect. So you see here on the left-hand side our pregnant mom that may be arriving at your hospital or your OB provider for services. And at that point, they may also then be identified to need services for substance use, MAT treatment, behavioral health services. So through the use of the e-intervention platform, that provider for the hospital, whether it be a case manager, a discharge planner, if you have peer recovery coaches available in your ED, for example, they can log into the e-intervention platform and capture just a few pieces of patient information to refer them on to start treatment for substance use or MAT, for example. Within the platform, we do have the electronic consent available, so you can capture that right there with the patient on the screen, and the patient can either sign with their fingertip. It can also be printed and signed as well. And then once that referral is generated, we have this closed loop real-time update within the platform. So as referrals are sent over to that substance use or behavioral health provider, as those providers receive the referral information, you as the sender can go in and see in real time what kind of actions or statuses are being taken upon that referral. We also have a great chat functionality as well. So we know it can be difficult playing phone tag or email tag back and forth, trying to see if the referral went over or if there are any questions or follow-up information. So all of that can really stay within the one platform rather than having to go out and use your phone or email to reach out to that provider.
Mm-hmm. And that chat feature is a secure messaging feature.
Yeah. Thank you. Great.
Mm-hmm. Sure.
So that was kind of the overview around the referral management aspect and what the provider can expect using e-intervention. But the other unique aspect Chest Health built was the patient engagement and really engaging aspect with this Envoy app. So as the provider is capturing the patient's information, typically nowadays most patients have a smartphone available to them. So they can send a link to the patient to download this Envoy app. And it has specific information then for that substance use or behavioral health provider. So you'll see details on the location, phone number or address information. Excuse me. The other aspect is around motivational and informative education videos. So your patients may be feeling a little bit apprehensive or fearful about seeking substance use treatment. So there are specific videos that we have tailored and identified, particularly for pregnant moms, for education and really testimonials that other patients have recorded and are available in the Envoy app. There's also the messaging capabilities through Envoy. So once the patient has uploaded or downloaded the Envoy app, both the sending provider and the receiving provider can message with the patient. So if there are any questions about just confirming their appointment time, or they have questions about what they can bring to treatment, that all can again be sent back and forth through Envoy. And again, just really providing kind of that tethered opportunity to keep the patient engaged and connected with the providers while they may be waiting for their actual arrival date. So this is just a deeper look inside that Envoy app. You can see that individualized welcome with the patient's first name, and that first home button there would be that provider of the substance use or behavioral health services. So they could instantly click on that and it would ask them if they wanted to call. They also have the messaging capabilities and this video with informative and testimonials. So I'll go ahead and play this video for you. This is specifically a patient that was on MAT treatments during her pregnancy. So let me know, Kathy, maybe if
Sure.
you can hear the audio.
So this is my baby, guys.
Yes.
As you can see, she's a little chubber. And I wanted to come on here and talk about babies being born to people on Suboxone. Now, my doctor had told me I was on Suboxone for maybe 4 or 5 years before I found out I was pregnant. It was unexpected, but I was mainly worried because I thought that my baby was going to withdraw. And I just kept thinking, I don't know if I can see another person go through this because of me. And so the whole time, during my whole entire pregnancy, I was terrified. And when my baby finally was born, an hour later, she went into the NICU because they did know that I was on Suboxone. And so we waited, and she ended up spending 7 days in the NICU and had no withdrawal. I really just wanted to come on here real quick and put this on here because I know a lot of videos are about like the bad things that happen. So I really just wanted to give you guys some hope and, you know, put some light on the situation, like good thoughts. So I think my doctor, which is a very good doctor, Suboxone doctor, he really knows what he's talking about. He goes to his seminars and he's such a good doctor. I'm not sure if I'm allowed to say his name, but I think he said it's about like a 60-40 chance of getting a baby that's going into withdrawal from Suboxone. So if you guys have any questions or anything about my experience, feel free to comment, and that's it. Say bye.
Nice.
So again, just a great way to provide some encouragement and motivation for these moms that may be seeking treatment.
Great. And I just had one comment on the videos. So you can, oops.
Go ahead.
Great, to make sure I'm unmuted. I just wanted to also mention, as Nicole alluded to, that the content, these videos, they can be customized. If there's custom content from either the sender or the receiver, we can add that to the Envoy app as well.
Yeah. Perfect. Thank you. Great. So as I mentioned earlier on, we have this just simple 2-page referral screen. So again, the web-based e-intervention platform, as a sender or receiver, you'll be able to log in. Creating the referral is, super simple. As we said, with these few items that are highlighted in red, that's really all that's required to generate the referral. And then if there are any additional details, we would always welcome that information. You can add in additional comments, add attachments to the referral if there are specific forms that your providers typically use that can be included in the referral. And then really on the second page is where we would capture some of those specific services that you're looking to refer the patient for. So you can see, or it might be a little hard to see, but the two red icons, the presenting problem and requested services. So those are really the key pieces of information that would then populate from that larger tab on the right, the provider finder. So if you're looking for specific services for alcohol or substance use, MAT treatment, from the provider finder, it would narrow down and only show providers for those specific services. From the receiving side, this is the referral inbox. So as new referrals are generated, they would come to the top of this list here, and the provider would also receive an email notification that there is a new referral. And so that would just be a great way to remind yourself to log in and gain additional information around this new referral that's come in. And really just best practice, we've seen many of our other customers that just any type of action upon the referral within 24 hours really helps kind of ensure that the referral is either completed or just acted upon. So there are different statuses for the referrals. As I mentioned, once you go in and open that referral inbox, you'll see the green indicated. And then as you go in, look at the details for the referral, it would automatically update to viewed. So if you are the hospital or OB provider, you wanted to look in and find out, kind of what the status is, again, that would automatically be there for you as an update. If you wanted to, put that in any of your case notes, if you have any ED discharge phone calls that you're making to reach out to patients, you could use this kind of as a way to set that conversation. Go in, look at the referral status, and use that as your conversation with the patient. So scheduled also, you can indicate what the date in the future would be if they're scheduled for an appointment. And then if you have it scheduled and it's past date, past due, then it would switch to that red indicator. For the closed referrals, there are various dispositions, so you can indicate if the patient arrived elsewhere or if they declined. Any other unknown or other is another status you could select. So another great feature with the intervention is the analytics component. So one of our tabs that's available, you can really capture the specific referral percentages. If you're completing reports right now for your organization, trying to track or trend referral dispositions or numbers of referrals, that could easily be captured here in our analytics platform to hopefully provide a little bit more efficient way and referral details for your organization, and really breaks down the level of services, specific payers, if there's insurances that you accept or do not, that could be called out here as well. So again, just wanted to highlight a lot of the feedback we've received from our current customers and the potential for this use case with pregnant moms and the benefits that we've seen. A lot of the back and forth with paper referrals or handing a patient as they walk out a information sheets on an agency or provider doesn't always guarantee that they show up for that treatment or that service. So having the use of this electronic referral platform really ensures that the referral is sent over and reduces a lot of kind of the back and forth. And then really the patient engagement aspect as well, since we know patients that enter treatment and stay in treatment longer certainly have better health outcomes for themselves and for the baby. Before we jump into this, Kathy, I don't know if you wanted to share that case study that we had with the Forster ED and some of their positive
Yes,
results that they
yes.
had
So
seen.
yeah, in another state, in South Carolina, we have another customer that is using e-intervention, and they are also sending referrals from the local hospitals over to the Forrester Center. And we do have a case study that we can share with you that recently was completed. And they are really enjoying using e-intervention, and they have sent, it's been over 225 referrals so far in 2020. So they're really, they like the use of e-intervention, that the referrals go to a centralized inbox. There's that color coding, as Nicole had showed, in terms of the status, easy to move the referral across those different statuses, and then the analytics piece that they have. They can really see how many of those referrals were actually converted to an actual appointment.
All right, so we'll jump into kind of next steps around implementation. So as part of this OPIC collaborative, we've identified the kind of first 15 hospitals that we would be working with to implement the e-intervention platform. So hopefully for many of you on the line, these are your organizations up here on this list. And as we meet with each of the individual hospitals, we will really draw out the specific workflows that will make the most sense for your hospital or your OB provider environment. So, the typical referrals that you would send out, and agencies or organizations that are either identified as a contracted provider from our list from the state of Oklahoma, or if there are others that you work with, we can work to add them as participants. But typical services, again, you can see here, MAT or outpatient services for your patients. So more specific details around how to participate. So we mentioned those 15 hospitals. For each of those organizations, whether it be an individual hospital or a health system, we have just some paperwork, terms and conditions, and a BAA agreement that we would ask your organization to sign. We also would accept a BAA from your hospital as well, so we're happy to sign that. And then from our side, so the Chest Health team, I would be reaching out to each of the hospitals and organizing the initial planning meeting. So we would do kind of the kickoff. If there are team members that were not able to join this webinar today, we're happy to do a general overview of the solution for them. And then from those that are, really involved with your referral process, we would want to identify those staff members, create their logins for the e-intervention platform, and I would walk through a training session for each of those staff members to ensure that they have some confidence and comfort using the platform for referrals. And then once the staff are trained, we would send out go live communications. So the existing providers within our network would know to start looking out to receive referrals from your organization, and any other new entities that we would add on as well. Oops, sorry. Oh, yes. And then, really, as we mentioned, the analytics, we will certainly keep our pulse on the utilization. I will be, working with all of you and keeping ongoing meetings and touch points if there are any questions or additional support as we roll out. I will be that main point of contact for you. again, just driving home the importance around this project and the success measures with implementing new technology. So we're looking to really reduce that phone, email tag, drive that patient experience, and really recreate or innovate the referral process, providing a streamlined approach with those real-time analytics and insights that you may be able to gain that perhaps before with the paper referrals was not an option for you.
Mhm.
All right, so just as immediate next steps, as I kind of mentioned before, there is just some paperwork we would work with your organization to have completed. And then from each of the hospitals, Barbara has been working to identify a contact person, and we can send you that BAA paperwork. So once that's returned, then we can work to organize a kickoff and staff training for e-intervention. And as I mentioned, the BAA would be, one BAA would be acceptable for a hospital or health system at the system level. We would just ask if there are other OB providers that are independent, that they would also need a separate BAA signed for this implementation. So we'll send out this presentation as well after the webinar, so you have my contact information. And I think at this point we can go ahead and open it up to any questions from the folks on the line.
Mm-hmm. And if there is a question, you can either you can unmute yourself, or I guess we can check in the chat box to see if there were any questions.
Yeah, thanks so much, Nicole and Kathy.
I didn't see any.
Feel free to ask questions now. I do want to point out, you saw at the beginning kind of who is already working with Chest Health. So we know that through this work, we will be adding additional senders and receivers and other, all types of different organizations to this network. So it will grow as we're using it. So, the first step is to get the folks on board at your hospital and at your OB provider clinics who do these referrals, to get them on board with this. And you may have a different, MAT provider, behavioral health person, provider in your community that can also be added. So this, and just so you know, that network will be growing as we use the e-intervention platform.
Mm-hmm. And myself and Nicole, we work very closely with Mary Kate. Cole she's listed here as well.
Hello.
She is our liaison. And so we are closely working with Mary Kate every week.
And feel free, if you ever have any questions, like administrative questions or anything like that, feel free to email me, and my address is listed here on the screen.
Mm-hmm.
Barbara, we do have a question in the chat regarding which hospitals this service will be available to. Is it only limited to OMNO facilities?
I think currently that's our plan. I'm sure if there is, another hospital that would like to participate, if you'll reach out and we'll work with you as well. We do want to expand the reach of this, but we wanted to, as you all know, how this is such a complex issue. We're trying to control a little bit how we grew with starting with some pilot hospitals. But if there is another organization that would like to join that is not part of OMNO, if you'll reach out to me or and let us know, and we'll work with you on that.
It looks like we had a couple other questions. The cost for using this service. So for those no hospitals, there is no cost. As Mary Kate just responded, thank you. I saw that come through. So this is part of the grant funding through the state of Oklahoma. And another question for the population. So would this be for behavioral health as well as substance use disorder? And yes, certainly we have within our network behavioral health organizations as well that you could use for this referral process.
Great. Well, and thank you, Nicole. Yes, as she's laid out the simple process for the next steps. So you guys will be hearing from Nicole as she works with Barbara to identify the contact individuals at each of the senders at each of the hospitals.
And just so you all know, the hospital people that are on participating today, we have already, we've used your Omno team, your main contact person as that contact person to send to Nicole. If you have anyone else that you would like to add as the main contact or thinks needs to be involved in this communication, let me know and we can forward that on to Nicole and the Chest Health team.
Mm-hmm. Oh, it said, is it free of charge for the patient as well? Yes, correct.
So you all don't have any cost associated with this program.
Mm-hmm.
Thanks to the support from the Oklahoma Department of Mental Health and Substance Abuse Services.
So I did, this is Mary Kate with the Department of Health and Substance Abuse. Our state opiate and stimulant response grant is what is funding this project. So there is no cost for any of our contracted providers who are receiving the referrals, any of the other support services in the community that get enrolled, and there's no cost for the patients to use this to get in contact with those providers.
And I think it's going to take all of us, there's a learning curve involved with this. And as we start as your providers and referrers and, it may be a nurse in a clinic or an office manager or someone, as these folks start using the app, I think, that's how you're going to really learn how it works.
Mm-hmm.
But they will be doing training for everyone as well so that people will have a good understanding of how this works.
Right.
Exactly. Yep.
And the training, as Nicole had mentioned, is very quick. It's a very intuitive platform. And then Nicole will be the individual that, if you have any changes in your staff, if you add individuals or any individuals leave, you just reach out to Nicole and she will create the new ones, and then she can remove anyone who may be leaving your organization. And then she can provide one-on-one training, but we're also recording this as well. And then the trainings, if we need to, we can also record the trainings, but we're also available to do any individual trainings as well.
Mm-hmm. Great. Thank you so much, everyone, for your time today, and have a great rest of the day. Looking forward to working with everyone.
Thank you all. Have a good day.